Put it right into it. It put me over the edge. Yeah.
Doesn't drink that she's gonna start now. It's like,
That's
that's
right.
we drove her to, Tina, right off the bat.
Well,
We didn't even like.
I want to say probably not the first time. At least on my behalf.
That's true. I would have thought Judi would have forced you to drink, Katie. I don't know. Maybe I'm wrong.
No, she does. No, she keeps me from drinking.
Judi's
I
already
will
drinking.
say this. Yeah, right. Well,
There may not
remember,
be
guys,
coffee.
I'm in Louisiana. So, when we say that we don't drink, it means like we don't drink at, 8 a.m., but we still pick up our little
I
notch
see what's
around
happening
11,
Yeah. You're drinking at a tailgate, but
It does not.
Yeah.
So
no,
good.
No, I'll
I
have a glass of whiskey every now and then.
oh, okay.
Well, at least she drinks the good stuff.
Yeah,
Yeah,
don't mess around. That's what I say.
If I'm gonna go for it, I'm gonna go. I'm all in.
Nice.
Yes. Yeah.
Judy, however, you had no reservations. You're like, what? What time is it?
It's 5 o'clock somewhere.
That's right.
You're not working
I
today,
don't,
are you?
I don't understand. It's like it's always 5 o'clock somewhere.
That's right. That's right.
And
That's
it
why
is.
she keeps coming back.
Yeah, that's right. So, Katie, do you know the story about Judy and I, or are you like,
No, I don't know. Well, here's what I do know. I'm sorry. Let me be fair to the process. I do know that you guys work together and yet you're still friends. So tell me about that history. No, on both parts. You don't know who that's in reference to.
Yeah, I'm just gonna say, like,
no, this is good. I like this already.
I think she's referring to me. I'm not
Spicy
sure.
this morning. It's very
She doesn't know
exciting.
me well, so I'm assuming it's about you, Judy.
I mean, that says a lot, right? If you really work with someone and yet you stay friends with them, that says a lot. That says a lot. So, what
Well,
is the history?
Not only
When
that
have you
is
guys been together?
we worked together, and then I recruited her to come work for me, and she somehow said yes. My recruitment was something like this, which Judy loves. I tell the story is I was like, look, we're getting this new client. It's in Baton Rouge. You only need to go once in a while, like probably like once a month, maybe twice tops,
Couple days.
And this will be temporary. It'll be temporary. Like, she's like, I don't really want to travel. I think it was like, this is literally what she said to me. I'm not sure I really want to travel. And I was like, well, it's limited travel. You can barely have to go down there. Mind you, this is 9 years ago.
I was going to say, in 10 years
And
later,
she's
so that
still
was 9?
traveling. And she was way down there, well, way more down in Baton Rouge than once a
Oh,
month.
yeah. Well, yeah, because you can start off by also telling her how the day one, we flew down to Louisiana. On day two, I'm on the job. We walk into a committee meeting with all of the leaders of Franciscan missionaries who are involved in the Epic Go Live. And he says, I'd like to introduce, our new project manager, Judi Sarti. And by the way, she'll be here every week, and she's the one that's, she's going to be your main point person, and she'll be here. We're going to have them here Monday through Thursday, and she'll be here every week, through the Go Live. And I was like, and so then I had to smile.
I don't
and say,
remember this,
yes,
but she
here I am.
vividly
Oh, yes,
remembers
I
this
do.
conversation.
I was freaking out.
So then
thinking,
that
I'm gonna be
conversation in the rental
divorced.
car, so then that conversation in the rental car after was pretty interesting, I bet. We should have recorded
I was
that.
like, are you kidding me? My
I
husband's
was
going to
blacked
kill
out.
me.
I don't remember any of this. I don't remember saying that.
Yeah. No, she, at one point, Judy, you had, your permanent residence over here at the Marriott. So much so that, like, look, y'all, I saw a friend of mine, talking to a friend of mine. She mentions that she worked over at the Marriott, and I was like, oh, I have some friends that stay there all the time. And I said, they're with this company, Healthrise, and my friend that's a bartender was like, oh yeah, that's Judy and the whole gang. Like, she knew them better than me because
Oh my God.
they work over at the Marriott. Yeah.
Well, they said the
course,
two
the
words, like
bartender.
bartender. Yeah, I mean,
Well,
Healthrise
Yeah.
and bartender.
right, that's right.
Yeah.
Like,
That's a
I know those guys.
yeah.
Judy
Yeah.
loves
Yeah.
a
Yeah.
robust red or a.
Thank you,
Yeah,
Tina.
exactly. She was like, oh, for Christmas, make sure that you get her, the Frank family. She likes, the 2017 Frank is really what she's feeling these days. Because they serve that at the Marriott in Baton Rouge.
Nice.
Of course they did.
First they
Oh
did.
my God.
Sutter home.
We had just hired like Ian and Zell and those guys like right out of school, like right out of college. Like we put them down there with Judy. Oh my God, what a
Those young
trip!
pups. Yeah, they were
They
young
were young
pups.
pups. Yeah.
Now they're
It's
running
been
the
great.
world.
It's a great ride though. It's been a great ride. I mean, could
They're
not
good
have asked for a
people.
better partner, honestly.
Yeah.
Could not have asked for a better partner. It's just been great. So after I got over the initial, I wanted, shoot. But after that, I was he always
Well, I
came into
left like soon after that. Not that FMLHS was the problem. It was me, but
that's the second
that
time,
was
but Ben, truly, that's the second time you recruited me because to be fair, you recruited me when we were working for the other company and you wanted me to come over. I was kind of on an implementation and you said, "Hey, we need some help over here." And you convinced them to send me over to the business office and work with you.
oh, that's right. God,
Yeah.
see, I don't
Yes.
rem I'm
He blacked
too
out there too.
I'm too
Everybody
hmm
did.
often like
hmm
like convincing people to do things, and so
Yeah.
maybe that's what the
So we
problem
will.
is.
So I have to question the next time you walk into my office and say, "Hey, I got a great opportunity
Yeah,
for you."
don't take it. Just say no. Just, whatever it sounds like, whatever I'm telling you, just say no is what I would say.
Mhm.
Well, very good. Katie, why don't you just do a quick intro? Why don't you both do? Because we don't do intros very often, but like we probably should. Just like give us your role and kind of little bit of background.
I'd love to. Thank you for the opportunity. I'm over the ambulatory revenue cycle, ambulatory, or if you're on an Epic shop, we call it PB, or if you're on neither, then you just call it like the professional services. I'm with FMOL. We are a 10 hospital health system based out of Baton Rouge, Louisiana, that we were talking about. Our claim to fame is that we have a lot of fun. We're a parties town. And we also run a pretty good health system. There was a famous saying, so we are a college town. Our other claim to fame, besides FMOL, is LSU. And a couple of years ago, we had a great coach that had a famous statement, and he said, we're a damn strong football team. And so I like to say that a lot. I like to say, we're a damn strong health system, considering we're in Louisiana and Mississippi. Our overall health system, we're about, 188 million. And yeah, I'm referencing my notes because that's a moving target because like so many other health systems, we're on the growth trajectory in our PB world, in our ambulatory world that my little placeholder here. We're going to hit around, what was my number for this year? Again, 780 million in revenue this year. So, we have a nice little chunk of our overall picture. We have about 1,500 employed providers that we bill for, around 350 locations. And my rev cycle shop that I have the pleasure of being a part of, and sometimes get to say that I lead, other times get to say that I follow their operations. We're about just under 300 in-house employed. And then we have, within the past year, we've done our first foray of offshoring and picking a strategic partner and doing some offshore outsourcing with some global resources, a combo of stateside, but also offshore. And we've got that number is kind of moving, and that's the intention of it, but around about 50 folks that are also embedded in our rev cycle that are offshore.
Gotcha. Actually, Katie, not to correct you, but your claim of fame is actually that you have the longest name of any health system in the United States,
You're
which is a
telling
true
me.
statement. True statement.
Yeah. Yeah, yeah,
It's the longest name. No, there's no other one that's as long.
yeah. And often confused because there is another Franciscan health system, but we are Franciscan Missionaries of Our Lady Health System, also known as FMOL. We have an identity crisis. We need to just pick it and stick to it. Yeah. Yeah.
Well, I
Very
found
good.
that either people know what that is and they're like, "Oh yeah, I know those guys," or they're like, "What is it?"
I know.
I'm like, "Yeah, it's a long name. I just gotta go with it."
Yeah.
Yeah.
Yeah. But then locally, it's also funny, we've been here forever. Um, I'm from Baton Rouge, born and raised in Baton Rouge. And if you tell, 9 out of 10 people that you tell in Baton Rouge, who do you work for? And if I say FMOL or Franciscan
Yeah, yeah.
Missionaries, they say, who? Who? What?
Oh,
Who are you? So, yeah. And actually, our marketing folks would say that we are having an identity crisis and they are working to correct that. But for now, it's, I just work for that health system. I'm just the billing lady. And that's usually what I say anyway. I'm just the billing lady. Yeah.
nice.
Nobody knows the definition of revenue cycle anyway, so
No.
it's very difficult to explain what you do. When people ask me
Yeah.
what I do, I'm always like, I just work with hospitals. It's
Yeah.
so much
I
easier.
just click the
So
button.
much easier.
Judy.
And then I
Yeah,
always
we
say,
lick the
not
envelopes.
doctors, though, not doctors, because then
Right.
people think that I'm a clinician, and good Lord, I can't even watch them take blood from me. So I'm not.
Oh, Judy, remember Sparby'd always be like, "We're saving babies here. That's what we do."
Yeah, it's like, and I was always like, we're not saving babies.
In a
So like,
roundabout way, in a very, very roundabout way.
Right.
It's not direct, but
So
it's somewhat like that, similar.
So speaking of Judy, I'm very curious. Judy, how do you describe what you do? Because what I do, and I didn't even describe what I do. I don't even know what I do. I'm just here. But Judy, you have a really complicated role too. Just I want to hear your pitch. What do you do?
so again,
She
my
works
pitch
with
is very
hospitals.
simple. I work with hospitals. I do. I say I work with hospitals, and I work with hospitals on their billing. That's what I generally say, to get the bill out the door to the insurance companies. I just kind of very simple, whatever, very simple. I just try to tell them that. But yeah, so Ben, introduction. I'm Judi Sarti. I am with Healthrise that Ben had recruited me to. You heard the adorable story in the beginning where how we were such great friends, and I still love him for this. But I am the vice president of operations, which means I'm really the relationship executive over my partner, which is the Franciscan Missionaries Hospital System. And I lead a lot of the site leads at our other locations and try to help them, grow and build the same relationships that we've been able to do down in Franciscan. So that's my high level of who I am. But yes, when I am talking to people, Katie, they always ask me what I do. I tell them I'm a healthcare consultant. The first thing when they say, "Oh, so you're talking to doctors," and no, I'm on the billing side. I try to help them with their processes and figure out workflows that help get the bills out the door faster and get the insurance companies to pay, because as we all know, insurance companies don't like to pay. So that's my speech and my two, hopefully people kind of understand, but they don't really know because it's very complex. That world is very complex. And there's a lot of stuff you're doing. You're working with coding, you're working with the front end staff, you're working with insurance verification, you're working with a lot of different players in the game. So it's not always easy to kind of put it in a little
Well,
nutshell.
your
It's not,
explanation is easier than Tina eyes, that's for sure. I mean, we try.
yeah, what do
People
you
ask
do?
us,
Yeah,
I'm
what
like,
do you
What do you
do?
do,
Let's
Ben?
go around.
Tell
"Oh
us
no,
what you do.
Tina, no, Tina, you go first. I don't
What
need
do
to
I
know."
do? I work with I was going to say I work with hospitals. No. What do? I find it complicated because I'll say like, "Oh, I do writing and marketing, and then I do events." And then people automatically think when you say events, you mean like weddings. So I'm always like, no, I would never. That's not for me. Like corporate events, but then also like, conferences. I don't know. I know people. I do stuff. Judy, that's my explanation. I don't know.
You do
I
do.
just, and I do
I
like,
made,
and I get to do like really fun things that I guess people wouldn't expect, like in sort of the healthcare revenue cycle world. I feel like I get to do all the fun things that you wouldn't even think exist, because most of what I do is like deal with people and set up parties and buy fun stuff. Like, I get to do all the fun things, I guess.
So I read an
I,
article recently about super connectors and like
Oh,
the people who like so everybody is connected to a super connector. It's kind of along the vein of the super spreaders, right? So I'm not saying that you're a
gross.
super spreader, right?
but in a positive way, right?
Right.
Right, but on the positive way that like, so you're one of these people that like you just maintain a very large circle. And so, a lot of people would say that they know you. And so like that's the connection here. Like,
True.
yeah.
Yeah.
And so, but the interesting thing that I read about it is how vital these are to industry. So there you go. Like think about your connections, you and Ben and y'all's connections, and how much you have done to further the industry by connecting people that would have never otherwise talked.
Sure. Well, Ben knows everybody, in case you don't know.
Apparently both. Well, okay, but then you're the
He
man
does know
behind the
everybody.
curtain.
Well,
But
and
Tina
then
knows.
I know more people now than I've
You're selling
ever.
yourself short
And I
here.
always forget that I know people. Like someone will, I'm forever the person like, look, do you know anybody who kind of does this like odd thing? And I'm like,
Right.
no, I don't. And I'm like, oh, yeah, I do.
Actually, I
You know,
do it. I
give me a
do this
second.
one guy.
That's right. I was describing this, Katie, you probably don't know, but I used to have a Rolodex, like a physical Rolodex. And
Oh,
I used
yes.
to write on the back of the cards, like facts about people. And I think that habit really did something to my brain to like, I just remember strange things about people. Like Ben always says that I have a gift of finding the most interesting person in the room. Where I end up like just having a conversation with people, and then I like somehow find out all these things about them. So I think like but it came, I think, from that initial habit when I was a publicist when I was 23 years old of like having like a physical card with their name on it, whatever, and then on the back I'd write, oh, this is their birthday and they love the color purple and their favorite flower, whatever. Like I'd write down whatever, and I don't know if it like made circuits in my brain work differently, but I have the thing that I remember all kinds of nutty stuff about people. That's what I have. I don't know if that's... Somebody asked me recently what my superpower was, and I was
like... That's a superpower.
I was like, I think there's that. Like, I remember... my memory is a strange and marvelous and also awful beast, right? Like, it's
so you're a super connector. So that's one of the traits of a super connector is that they can remember people on a level that's different than the surface, so that when someone brings up, whatever, Pepsi,
sure,
gingerbread, whatever, you're going to think in your head, oh Katy mentioned Pepsi, gingerbread, blah, and so you can make those connections a little bit deeper, that then, you're pulling Katy into that conversation.
That's right.
Whatever.
I need to spend more time with Katy. I feel like she sees me.
I do. Well, maybe I'm an under of like no, maybe I'm not a super connector. I'm just like
unsung. I'm still confused about the Pepsi and gingerbread thing.
I know.
Is that like a thing?
You dip it or something?
I read about it. No, there's a new Pepsi gingerbread flavor.
Oh, no.
And I am so confused about it. But now I want to find it. But spoiler alert, I'm in Louisiana. We're not Pepsi. Like Pepsi is like shunned.
There's no Pepsi down there.
Nobody ever ships Pepsi.
Everything is Coke.
Yeah. So I actually was thinking about like going to Detroit, and I'm like, I'm going to find the Pepsi gingerbread.
I'll look at the grocery store.
I've never heard of this, but it sounds amazing.
Katy, I will look at the grocery store and I'll drop it off at the office.
Thank you. I was just going to say, I got to get on Tina to do that for me right now. That's when she gets up.
I'll check it out.
I need it at the office.
And I'll be like, nobody drink. I'll put a big thing on it and that says, don't drink this.
Don't touch.
Save for Katy.
Put it in my office.
Well, then it won't be cold. Do you have a fridge in your office?
I don't need it cold.
Okay.
Guys, it's going to be free. I need it hot. It's going to be cold. I'm already in shock about going up there. It's 70 degrees here, or 85 degrees here.
It was really nice until just this week.
Yeah, so it's cold.
You got unlucky. Oh. You chose you chose poorly, if I might be honest.
Yeah, I mean, I should have done this probably in June.
It could be a great... I feel like, is it a great opportunity for like a new coat? I don't know.
For her to wear once?
Yes, for 3 days, couple days.
I'll figure it out.
I don't know, but Judi has a coat she can loan you.
Oh my gosh,
but then do you even like wear them? Like, see, this is so foreign to me. Like, I don't know how to do this. Like, do you even wear a coat? You're going in, you got to take it off.
You wear layers.
I'll figure it out. Okay.
Because it'll also be cold, and I think it also will be cold in the office. Just forewarn you.
Good. Mm-hmm. So wait, I really need, I need to know, but Ben, what is your, events, Tina, like, I need to know this. How do you describe yourself to the guy on the bus?
I don't typically.
No, strangers on buses are like, hey, I know you. That happens to Ben.
I have had this. Yeah, that's happened. I typically will try to, like, my wife always laughs at this because she's like, she still can't explain it. So I will typically say, like, I try to get off, like, well, it's, like, if someone asks me, like, what do I do? I'm, like, always, like, it's complicated. And they're like, what? And I'm like, well, I mean, I work in healthcare. And they're like, and if they care any more, they'll ask me more questions. If they don't, they're like, okay. So if people ask more, I'll typically talk about the fact that I'm in this kind of niche business that's all about, hospitals, physicians getting paid. And then if they ask more, then I'll like go into like, I have a couple companies, I do a few things, I'll get into more, but it's like, it's rare that I get into like someone actually knows what I'm even remotely talking about. If it's real simple, I'll just say I'm in healthcare finance. And then people like, oh, okay.
So you sound like an accountant. He's an accountant.
They don't know. They don't know.
You probably get in trouble, Ben, when you say it's complicated. Because now, as a curious person, I want to know what your complicated life is. You know what I mean? So, like, maybe you should just say healthcare finance, and then people will leave you alone. I'm not sure.
That's true. That's true. Maybe it is.
People don't care
Uh,
about
Because you're like
healthcare
making it
finance.
mysterious with
I
the
wasn't
Yeah,
that's
trying.
with
I'm not trying to make it mysterious.
yeah.
It is
But
complicated because I have a couple
It
companies, and
is.
it's not as simple as like, I have a job. Even Judy, your job doesn't sound simple, but it is like you have a job, you do this thing, you run apps for, so you're a consultant. I don't have that anymore, and I haven't had it for a while, so it is complicated. I think the other thing too is like when Tina's talking about what she does. I made this mistake one time of like introducing Tina to somebody, and was like, and I said, "Well, Tina's in all. She helps me with all my businesses." And then the guy goes, Tina remembers this because it's such a stupid, like, the guy goes, "Oh, having a great EA is like,
Oh
it's
yeah.
essential."
Oh, I remember that. I do remember that.
And I was like,
Yep. And I was like, oh, that's not what that is, but okay. And I was like,
Which,
in the moment, I was like, this is not the
I
time
was
to
like,
change
whoa,
this old
whoa.
man's point of view.
Yeah,
Like
yeah, clearly his point of view is like, "Oh, that's what a woman does." And you're like, I was like, "Whoa, wait a second. That's not at all what I was
no, and I don't think
uh
I didn't feel like you said
helping me with all
that.
my businesses does not mean she's like, so
Yeah.
anyways, just like I have to be clearer about like when I introduce
I
Tina
plan
to
Ben's
people
travel.
because that's not
People
true.
do people will ask me things. I'm like, that's not a thing that I do. Like, you need to talk to him
which,
about that.
to be fair, like a good EA, like God bless, we need the good EAs in this world.
Oh, of course.
But yes,
Right.
but if you're not, if that's not your, like, I would be a horrible EA. So like that's why I have so much respect for our admins
I haven't
and all
had an
that
EA
because
since I was at R1, like a creative.
yeah.
That was the last time I had one. That's been 20 years.
Yeah.
Yeah, Amanda.
Oh, yeah, but she was like the office EA, right? She was
But
like, yeah,
that
yeah,
was
yeah,
that
she
was the
did.
only thing I've ever been
Yeah,
close to.
yeah.
Outside of that, I've not had one. So it's like,
I was an EA in my prior life. I've had a lot of jobs, including travel agent and worked at a
Really?
car dealership. However,
Wow.
being an
well,
EA,
I
I
could see
had
Judy in a car dealership. You'd kill it there.
yes.
She would. She probably did. She probably was
I wasn't
aces.
in sales. I
Kill
wasn't in
it.
sales. I
Oh,
wasn't in
really?
sales.
What?
Oh.
I know. I worked in the service department. I wrote up
Oh
so
wow.
when you came in and you were very,
Yeah,
very
yeah. Oh,
angry
yeah.
that your car was not working
Oh.
properly,
It was Judy.
it was me. Yeah, it was my fault. And it was my fault if I couldn't get you in right away and your car back in by that
Ooh.
afternoon. And oh, yeah,
So
I
you're
only
really
left
It
there
was like
good
a
like
at
three
this.
service
months.
position. Yeah.
It was horrible. It
So
was just
that's
like, it
why
was depressing every day.
So that's why you're in healthcare, though, healthcare billing, because I mean, that's like, right? Isn't that it? Like, if you stay in industry, if you stay in a health system, it's always our fault. It's never the doctor's fault, which actually it usually isn't, right? It's never the doctor's fault. It's never the
Oh,
process
or it
fault. It's
usually
never
Right.
the
is.
insurance company's fault. It's always the billing people because we're the nameless,
Right.
faceless
You're the.
billing people.
Yeah,
No
true.
matter what.
My
No
insurance
matter what.
company told me it was your problem. Like, sure they did.
Yeah.
You talked to your. You're like, wow. They answered the phone. No.
Yeah,
You
Yeah.
talked to
wow.
your insurance company? That was your first mistake.
Yeah.
All right, so we wanted to talk about you guys have an interesting relationship that I'll take credit for.
You can.
I
Nice.
mean, might as well.
Well,
I mean, you might as well. Yes, you might as
Yeah,
well.
sure. Katie doesn't know this, but like I set this up many, many years in advance, and uh, but I also think like it's interesting relationship that when we started Healthrise, I kind of remember the thesis of like we want to do something similar to a creative, but do it the right way is what we would say. Where creative was pretty onerous, this was like a more of a real partnership, infused management model. I think we'd say. So you guys have been doing this for a long time. This probably has many iterations, and I'm certain it doesn't look today uh, like it did 9 years ago, Judy, when you started. But you do have kind of a classic consulting, um, and I'd say this is long term, so it's a little different. But classic consulting, provider relationship. Um, and I'd be curious from both sides, like what's made that work, what hasn't worked. 'Cause I think what I hear a lot, maybe just this, I'll ask a question, but also the thesis of like I think what I hear a lot from providers is I've got this consultant in and it's not going well. They're telling my CFO shit that they shouldn't say. They're coming in and kind of like making my life miserable. I hear that a fair amount. I also hear the other where it's like, no, I love these guys. These guys are helping me, right? Like, so I've heard both, and I've been a consultant for a long time, so like I know what that's like to be on both sides. I'd be curious, like, how is it working for you guys? What are some things that have really worked and what hasn't worked? And you can fight over who goes first.
Katie can go
Judi.
first.
Okay.
Katie goes
Okay.
first.
All right, I will gladly go first. So when I joined the health system back in 2017, and when I first joined the health system, obviously the Healthrise arrangement, this partnership that we have with Healthrise was already established, and I came in, was initially hired to do some fixing in our cash posting place, in our cash posting shop, and my then boss at the time who hired me said, look, you've got a great staff. And my inherent staff that I stepped into, incredible. But she said, you've got a problem and I'm hiring you to take charge of this problem and to fix it. And I'm giving you this Healthrise person. And I was like, I thought I knew the industry. I know a lot of players in the industry. Who the heck is Healthrise? To your point, Ben, like I've been burned by consultants before. Like they come in, they zoom in, they do something, they get out, then we're left with, well, what did you do? You may have fixed the problem, but we don't have long-term sustainability. And I remember expressing that initial hesitation to Ramona, but her caveat was, but wait, Healthrise isn't going anywhere. So this was set up, way before me. Thank you, Ben, apparently, for setting this up. That I think that our health system, recognized the leaders before me, our former CFO, Mr. Ramsey, whenever he first set it up with you, and then Ramona Fryer, both of them being very seasoned in this space, recognizing that, maybe we do need a relationship with an external party that can come in, because we all know that there is value sometimes in having a third party opine on a situation. They might be saying the same thing that I'm saying, but people are going to listen differently because they're third party. That's okay. You need that in business sometimes. But also being able to leverage what they have without the administrative burden of running a staff, that they can just be, as Judi often says, at the elbow support, an extension of my leadership team. But the key is Ramona and Mr. Ramsey, when I was onboarding and they said, we've got these people, they said, they're not going anywhere. And so, and I will say, over time, there have been different folks who have filtered into our engagement, whether it was on the cash posting project or, if we have some go live support, acquisition support, there may have been times when maybe the person wasn't the right fit, which I don't think is any different than if we were to direct hire. You're hiring
Right.
people, you're bringing people in. Sometimes they're not the right fit. But the difference was when we went into this with the understanding that Judi's not going anywhere. Judi is here to stay. Judi and her team and this arrangement is here to stay, and you leverage them as you see fit. That really framed it a little bit differently, that it was like, wait, we're going to make this work. And when there is a little bit of a concern, for example, Judi and I talked yesterday, there's a team member that's agreeing, a new hire in an analyst role. We're going to work through it. We're just having a check-in because this person is green. I knew that whenever we onboarded this person, they're doing great. But Judi and I collectively want to keep our finger on the pulse to make sure, are we doing the best that we can to onboard him together? And so that long-term sustainability, I think, has helped us frame this in a different perspective to invest in making this work versus just getting in 6 months, doing what we need to do and shipping people out.
But I think, Katie, like there's the what you said was important around they're not going anywhere. There's almost like I don't know. I would say like you you're coming in with this mindset already of like they're not going anywhere. But I think a lot of people feel threatened by them, like whoever they are, right? Like as in like exposing you as far as like I'm not doing my job. And so I guess what would be the what you had to have felt that a little bit at the beginning, right? If you were like,
I will say
or
I don't think that I ever necessarily felt that. But you know what? I mean, that's a tone thing, right? Like that's just Judi as the leader of this relationship has never approached a situation where she's put us in where, she's running to an executive and reporting something that she hasn't already discussed with me. And she sets the tone. And this is not just a Judy's awesome, although she is, but it's the overall tone of Healthrise and the approach that they have had to this relationship that has like been a mutual respect. Have there been things that probably I could go find another vendor that is more specialized and has a better understanding and could knock it out the park? Yes. But what they don't have is the background relationship that I have with Healthrise. And again, the mutual respect that we just, again, we all the parties sat at the table and said, we're not going to throw each other under the bus. And so I know that, there might be issues where Judy's reporting where our team is underperforming in a certain area or our team needs help, but she alerts me of that in the beginning. And that's kind of like the pervasive attitude of what they've had with this team is, look, we're here to help you. We are truly at the elbow, an extension of who you are as a team. We're going to succeed together. So, I've never felt that, dare I say. I felt it from other vendors, but I've never felt that from Healthrise. And I think that that's a culture thing.
And now, a word from our sponsor.
Today's episode of My Good Friends is brought to us by Switch RCM. And we've got Nate here today to talk to us about the incredibly fascinating topic of interest and penalties for payers.
Every hospital, or nearly every hospital and health system in this country, are owed interest and or penalties. But what we find when we talk to those hospitals and health systems, they can't answer the question of, are they being paid the correct interest and penalties? It's extremely difficult data to unlock, and we are able to unlock that using standard claims and electronic remittance data. So we're excited to give a level of insight into those interest and penalties that providers haven't had in the past.
And I can't tell you enough, folks, that no one in the country is doing this work at scale. And so these guys have figured it out. Contact Nate directly. Email him at nate@switchrcm.com and find out more info, because this is great stuff that they're doing. Thanks, Nate.
You're welcome. Thank you.
Now, back to the show.
Yeah, I was thinking it's interesting your perspective, because I think you came into something that existed.
I did.
When Judy and I went there at the beginning, there were leaders who were unhappy that we were there.
Yeah, that's
And that's
very
not
true.
that's not, I'm not throwing them under the bus. I'm just saying that is typical. That's
Sure.
that's not atypical in any of those situations.
Mhm.
So, Judy, I'd be curious to hear your perspective on like moving into that at first originally, and then now with like two new leaders that like they don't know any different. Like Katy doesn't know any different.
Yeah, I think originally when we got there, Ben, like, you said, like some people were a little worried about us. What are they going to do? How are they going to tell us to do our job? And I believe that what we did in the beginning was try to just listen and help move things along and take some stuff off their plate that they needed off their plate, right? So even just
Sure.
creating an issues list, that they didn't have before, but we're listening, we're creating it, or pushing where decisions had to be made. They hadn't made them yet, kind of driving like, and not basically even kind of saying, we recommend this route, but like, if you want to go this route, let's go this route, like however, and just building that trust where they finally got to a point where they knew that we're not here to take your job. I'm not here to, do what you do every day. My goal is to help you get through whatever it was. In the beginning, it was the Epic Go Lives, and they were,
Right.
phased, right? So they knew like 3 years, we were going to be around for 3 years. And then post that, we were just there kind of project managing some of the stuff that, you have staff that's doing their every day, right? And they don't, like, you bring in a new hospital, they don't have a chance to, okay, I got to leave my everyday and what my team is doing and go try to implement this hospital or bring them into the fold, right? They don't have all that bandwidth around them. So it's just like, oh, wait, we can just use Judy and her team to do that. Let's do that. And we have a proven process because we just did this implementation for the last 3 years that it's proven. It's a project plan, and you start here, you get to X, Y, and Z, and each time your lessons learned and you're sharing that information. So we've just been proven that we're just a good partner. And I know that we use that word a lot. We threw it around in the very beginning. We don't call our partners clients. They're not our client. They're our partner. And it's really true. But to build that relationship, you have to have trust, and you have to, show that you can do stuff for them and take some stuff off their plate. In the beginning, we did that, and we continue to do that today. And I don't, obviously we're all in the business to make money. FMOL is in the business to make money. Healthrise is in the business to make money. I'm in the business to make money. I have a family. I need to retire on an island. I have all these goals, right? So we're all in the business to make money, but that's not what I think about when I'm working with my partner. I hear her say, Katy or the new leaders now, like, oh my God, we're having issues in this space of coding, right? We have the coding issue. Like a lot of coders are taking jobs because now everything's remote. And so there was all these staffing concerns. And so I'm just like, all right, how can I help you? And I mean, if helping you is to bring in another vendor, that's what I'll do. If helping you is to bring in people or help with marketing, that's what I'll do. If helping you means I have a staff that can come in, whether it's,
Hmm.
domestic resources or, global resources, I'll do that. But my goal isn't just to try to, I don't have a goal in the back of my mind that says, oh my God, I have to push so many dollars, for the end of the year. And I think that's the difference between what we do and what a lot of these other consulting firms do. They're just worried about the dollars. They're going to come in, they're going to do a project, they're going to get out because they want to get to the next project and make more dollars. And I know that
Well,
if
their
if our
models
leaders
are
heard that.
different. Well, their models are different in that the partners, the way they operate is that they have a number to hit. So it is it's basically like they have a giant sales team because their partnership model is that the partner has to like produce so much revenue in a year.
Yeah.
So that's why I always say is like there's nothing wrong with Huron, Accenture, Deloitte. Those guys like impact. Like they know what they're doing. That is not the issue. The issue is typically like you better be real clear on your scope and not let it turn into something where it's like we're gonna be here for the next. Whereas I think the difference in this one is like you guys have like established like this is what we're doing for the long term, which is a much different type of arrangement. Um, so I do
Well,
think that the partnership model is difficult because it lends itself to like they want to like extend because they need to.
yeah. And I will also say, I get bombarded. I get at least 5 emails a day, cold call from vendors. The access to the market is so easy right now to set up a rev cycle shop. An outsourced rev cycle shop. I get bombarded. I know every other person out there with the title of Vice President Revenue Cycle is just bombarded daily. And I constantly have our CFOs. I said we're a 10 hospital system. We've got a ton of CFOs out there individually in the markets. Our CFOs are constantly saying, hey, I got contacted by this company and they said that they can, increase collections here and they can do this and this and this. And all due respect, I'm sure that other companies could get in and do something. No doubt. There are pockets. They specialize in work comp. They specialize in this, that, or the other. But there is something to be said, and my mantra back to our CFOs is, but there's something to be said about the background and my relationship that I have with my strategic partners, Healthrise being one of them, that, could someone else probably move the needle two percentage points a little bit higher in a given area? Maybe because they specialize in that. But if I don't have to have the administrative burden of onboarding a new vendor, of getting to know their culture, of trusting them, understanding their style of communication, and then deal with the aftermath and the fallout that some executive said something that upset half of my leadership team, like if I don't have to deal with that, guys, we can work collaboratively to get that 2% in-house with what we have, with our resources. Like there's just so much, it is such a relief knowing how much we contract out for all of our different revenue cycle support services. It is such a relief that I have an SOS and that I know who's going to pick up the phone, whether it be Judi or another member of their team who's over the IS team. That there have been so many times over the past 2 years really where we've been doing this turnaround of our ambulatory rev cycle that I've called up Judi and I've said, I need support in this area and I need it in 30 days. What can you do? And she has yet to say, we can't do it. Like she has yet to, and they figure it out, whether that is insourcing or they handle it for me, like she said, and find me a coding vendor. And there's just so much value to that. And I'm not the only one in our rev cycle who feels that way, everyone across the board. And again, I say, it goes back to culture and it goes back to the fact that Judi and her team did the legwork in 2015 or whenever you guys first got involved, that there were some culture or some opinions internally that they had to overcome. But probably the biggest naysayer end up, she's no longer with our organization. She's retired from our organization. But Judi, we all know her personality. She's one of our best friends now. Like the biggest naysayer in the beginning, why are they in here? What are they doing? Well, them by serving us and helping fulfill the gap and seeing that gap, that unasked question, answering the unasked questions, they earned our respect. Good job, Ben. You're a part of that too.
Well, I appreciate that. I think vendors, because I say both sides, right? Like talk to both sides a lot, and I think the vendors see it as like, well, I have something that you can save all this money with,
right? And if you only knew how I could help you.
But legitimately, they do, and I think some of these people legitimately do have something they could. But I always try to tell them is like sometimes it is like literally a capacity issue. They cannot like take on another thing because it's and a lot of times it's like an IT capacity issue, right? It's like we're gonna implement another thing that we have to like. You said it just a minute ago. It's like I got all these things and now I gotta build another thing. I gotta implement them, and that takes more time. Uh, and again, some of these, a lot of these groups are like, we'll do it for free for the first. And I'm like, guys, it almost doesn't matter. Like, it's not the cost. It's the cost of like the inherent cost of doing anything new. You have to really want to do it or be in a spot where, like you said, you're 2 years into a redo and you're doing all, it's like it's working now. And so it's like maybe you are at a spot where capacity starts freeing up because it's more routine, but it's not. Most cases it says, there's just too much going on. It doesn't ever stop. I mean, I try to like, guys, it's like the post office, like mail keeps coming.
Yeah. And I feel so bad. And I like legitimately feel bad for like the BD people of the world, because there's so many times where I'm like, look, I appreciate your product. Exactly to your point. Like I can't take on another project right now. Like I'll put it on, in 5 years, but I don't do tomorrow. I know for a fact that tomorrow, whatever I set my plan to be tomorrow will not happen. So guys, 5 years, like I'll try, I'll try.
Right.
Everything's always easy, isn't it? Like I just need a file. If you just send me a file, just have your IT within 2 weeks, we'll be up and running. And then we know like 6 months later, it's not just that file. The file wasn't right. So yeah, it's not that easy.
And
it's
actually,
never just a file.
You say that, like that has been a really unique use of our partnership with Healthrise. Like just to talk about that for a second. So where we do commit that I need to use, I do want to go forward with this particular coding resource or this particular autonomous coding solution. But then I'm like, how do I implement it? Like, I want to do it. We know that we know our goal. I have no idea how I'm going to like pull people off of production and get there. And that has been one of our biggest uses of
Right.
a relationship is like, hey, come
Program management of
leverage.
like how to even implement it,
Yes. Like give my leaders an extra 8 hours in the day. Yeah. That's that I get a lot of criticism about our spend because it's not cheap. Like, and could we insource all these people that we're looking at? Well, I don't know, because I live in Baton Rouge, Louisiana, and my workforce, unfortunately, is not so great. Because I'm not getting people who want to stay in town, but also we're global now, and I can hire anyone from anywhere, but Judy's able to pull in people. So until somebody can prove that I can insource and hire these, why not? Why not? I don't have to deal with the overhead. I don't have to deal with the administrative burden of bringing these people on. Judy's got that for me. And instead, I can focus on getting this autonomous coding solution off the ground.
Well, most times your HR is not set up to recruit the level that the talent required. I mean, it's just not.
They're not. They're focused on nursing, and that's great because you know what? I want nurses here.
I need rad techs and nurses and surge techs.
Yeah.
Like, that's what they need.
Yeah.
And they know how to do that, right? I'm assuming they should be good at that.
Yeah, they're very good.
It's the rest of the stuff that's like tough. I mean, I think it's just a different world.
Yeah.
Yeah. HR is always a challenge. I mean, anywhere you go, just levels and now with this new staffing kind of environment where people can be wherever they need to be, it's just it's really difficult to retain high level talent. It really is. I mean, so unless you're able to really pay a decent salary for folks and they're comfortable with what they're doing, it's been difficult. So, we're able to bring that in, even if it's on a temporary basis, or you're trying to, they've been trying for the last, I guess 12 months now, recruit a, executive level person at the hospital. And we've been able to, be an interim, and now they finally found one, because it takes a long time, but you can't let that job role just stay open until you can, find
Leave it
find the
empty.
right fit. Right. Yeah. So,
Hmm. All right. What about advice for people like my CFO hired a consultant and they're going to do an assessment on your rev cycle? This happens all the time. I mean, I used to do assessments. I certainly understand people's uh, hesitancy. I'm curious to know, like from both of you, Judy on the one side, Katy on the other, like what advice would you give for people?
Judy, you go first with this one.
so we just did an assessment, right? We did an assessment for, well, we did an assessment for Franciscan. We did another assessment for another client, very small little hospital, and King kind of came in and just to kind of help them in one little space. And it's really just about, I think the fear that people have when you come in and do assessment is that you're going to remove my job, right? You're coming in, you're going to see what we do,
Mhm.
and that means my job's getting eliminated. I mean, it's just that is just truly what I see. And what I try to go in and, the first meeting will be like finding out exactly what the assessment, what they want at the end of it, right? So first, when you got to have the conversation with the CFO and he says, hey, this is what I want to see. But then when you actually go talk to the staff and the managers and the leaders of that group, it just needs to be like, listen, I want to make your life easy. I'm not trying to, I can get, like, there may be places where people are doing, duplicate work, and, we can make it more efficient. But I know in the hospital system, there's plenty of roles open, people that you need filled. There's plenty of things that are being left on the back burner that nobody's getting to. So all I'm trying to do is allow you to have that capacity. So let me just go help, let me look at your processes and find, these places. And we did have to just do that. I mean, they had 5 people and they really needed 2. But there's so many other things that they're not doing, that we were like, okay, so now you probably can do this whole function with 2 people, but like here's the other 12 things that you're going to need at least a couple more people for. So, I mean, that's how I go about assessments, and trying to make people feel comfortable that my job is not to come in there and say, hey, you should outsource that entire department. It's more around, I mean, that might be something that they should look towards doing eventually in the future, but I just try to make them more comfortable around the fact that I am just looking to make your job more efficient and stop, doing all of these extra things that just aren't needed. That doesn't mean that your job is getting eliminated. That just means that your life should be easier, and, come in every day and enjoy what you're doing instead of struggling to get things through into the finish line.
Yeah.
Do you think people feel like in that assessment piece, like they're going to be exposed for not, I don't know, not efficiently doing their job, like more than having their job eliminated, that there's going to be some kind of retribution for the job they have been doing? Do you think that's a real fear?
I think sometimes people definitely know they're going to get found out that they've been sitting around doing nothing all day, right?
Well,
Well,
I wasn't
mean,
saying that.
It goes
I
deeper
mean,
than that, though. It
Yeah,
goes
I
deeper
think
than
it's,
that.
yeah,
I think it's like when we talk about imposter syndrome,
yeah, like being
if that
fraudulent.
already exists for someone, this is like the nightmare scenario. And for most people, it exists. So like, there's at least something in the back of your mind telling you have this job, but you don't really
Deserve
deserve
it,
it.
right?
So I do think there's this other piece of like this unspoken thing where it's like, this is my worst. This is like someone who's got really struggling with this. This is like their worst nightmare. That you're gonna get found out because you don't know what you're doing. Like we talked to Nate, our friend Nate, who we did an imposter syndrome podcast on. I was like, that is like the fear. So I think when that happens, it's like the fear becomes like a real tangible thing they may not even be conscious of. And so when you're stepping in, I think as a consultant to be like very aware that you are actually instigating that, whether you doesn't matter
Right,
how
their
nice you
greatest
are,
fear.
it could be happening anyways in the background. So I do think it's something that you have to be like, very aware of and intentional about like knowing you're probably causing that, whether you realize it or not, or whether that person realizes it or not. So that I definitely think is something. I always said this. I said that so Katie, I did sales, like business development for Healthrise for the last couple of years, and I was always an operator, right? So like I didn't know how to do this, and I said to this day I will still say this: the hardest sale in the entire rev cycle is consulting. Because either you know you have a problem and you're asking for help,
Yeah.
or I have to convince you that you have a problem or that you might have a problem, and then you have to like somehow agree, or I have to get someone above you to think there's potentially a problem, right? Like that is, or you're just like ready to go because you know how it helps and all that stuff, right? Like that's the rare. And so I do think it's like one of the hardest things because it's like that's not an easy sell. You kind of have to be hanging around knowing that someone you can go to when I do have a problem, if I don't have a problem today. And it's
Yeah.
rare that you and Epic kind of forced that, honestly, because I'm implementing Epic and I don't know what I'm doing, right? Like that was our kind of initial, because like, yeah, that's a hard thing. And it was hard.
Well, I love that you hit on imposter syndrome, and that's what I was going to mention. From having been on both sides of the fence, so I've never gone in as a rev cycle consultant and really done a deep dive, but I certainly we are in the business of acquisitions, and we are constantly acquiring clinics, acquiring new service lines, and one of my key roles as the rev cycle leader is to go in there and figure out how are we going to mesh this group of people into our group. And I'm very often having conversations with people at all different levels and saying, what are you doing, and how do we make you fit? And also having sat in that position, having a consultant come in, having an advisor come in. About a year and a half ago, we had another advisor come in that was hired by a separate arm of our business. But it was to do a pulse check on our rev cycle, to do a pulse check on our relationship with Healthrise. Sitting in that chair, it was intimidating as all hell. But, I went into this now, granted, I might have a different perspective than a lot of people. I do try to think about, that person sitting across the table from me. What is their perspective? Why are they asking me these questions? Are they a bad guy? No, they're not. So I definitely went into these conversations with this particular advisor, this consultant, with he's not a bad guy. He was hired. He's not out to get me. Now, he was hired to do an assessment. Is this the right decision moving her in to lead this department? Is this the right decision establishing this department? And you want to talk about imposter syndrome. I wasn't even in the position yet. He was recommending, and I knew that he was doing this assessment when I had someone recommending that we move out and form this solo revenue cycle, and that we move Katy into this vice president role. And God, I wanted it, but imposter syndrome, it was real if ever. But I definitely, I prepped myself in advance of those meetings and thought, I'm just going to be true. Like, I don't want to get into this situation where I'm over my head. And I really had to think about, like, I'm just going to lay it out to him, and I'm going to tell him the good and the bad. And I really formed that relationship with him. So my recommendation to anyone who has someone coming in, I know that some personalities are not easy to deal with. And some personalities, some consultants can get in and be holier than thou. But your job as the one who's being reviewed, my recommendation is give them what they need, form the relationship with them, let them see that you don't have your defenses up, and be true to yourself that, like, yeah, maybe you aren't quite ready for the role, but show them what you are ready to do and let them be the experts to decide, is it worth taking a risk and having you grow into that role? Is it, do they think that you can handle it? They're not always out to get you. And even if they are, so then the flip of that coin is, Ben, the folks who really can't overcome that imposter syndrome, or who can't overcome and can't open up, or to Judi, the folks that you're sitting there and they're just hardlining, and they're covering up that they're not doing their work. Well, guess what? They're not doing their work anyway. Like, I always feel like those things tend to bubble themselves up. Like, somebody who is not being receptive, then you know what? They're probably never going to be receptive. And they're probably not being receptive to someone coming in and interviewing for a reason. So to
Right.
everyone out there, like, just like think about the person behind. Like, they're not a scary monster. They're here to help, and use them. Like, hell yeah, I use this consultant to my advantage. You better believe that I made sure, I'll give you what you need for your report, but make sure that my gripe areas are documented so that we can fix them in the future.
Nice.
I've only had one leader in my entire career who took the mindset of, I want whatever you can tell me we can do better, because I want to do this next thing. Tell me everything. My friend Luke was that guy, and we're still friends today. But like, Luke had a totally different. I had never experienced that though. Like, my whole career, I did tons of assessments. Like, that was the one time where it was like a totally different type of attitude coming in. And I think that is something that is like, it can help you. Being defensive doesn't help you. Like,
No.
that is
So,
ultimately, like, as a consultant, I sniffed it out. My red flag for me immediately is the person's super defensive.
yeah.
It's like, okay, I'm gonna work my way through it. Like, I'm gonna build a relationship, like you said, Katie. But that's my immediate reaction is okay, this isn't good. Like, this is not someone I'm seeing as like a growth potential.
But on the
That's
flip
my
Yeah.
side,
that's As a
Ben,
consultant, that's my immediate reaction, right? Like, whether it's real or unreal, you being defensive is like the worst thing you can do.
and I think if you have the consultant on the other side who is not really listening and wanting to just, not take what you have, that's the other issue too. So like that's a defense. Like, that just doesn't allow for a good assessment to be had, because then people won't open up, right? So if you're already coming in
Oh,
as a
for
consultant,
sure.
like, right? So from your angle or from my angle, that's why I just try to build a relationship with these folks. Like, listen, I am trying to help you. Like, give me all of the issues. I might not be able to fix them all, and that's what happens. Like, the last assessment we did, we talked to a bunch of CFOs. He goes, I'm going to tell you a whole bunch of things, and you're not going to fix them. And I said, it's not my. I mean, it's not necessarily my job to fix them. My job is to, like, showcase what these concerns are that you have, and then the health system has to decide where, what their priorities are and how they're going to go. So yeah,
Oh,
but it's just from
totally.
our end, you just have to go in and try and build a relationship and build the trust there, that you're just really not trying to railroad anybody.
And now, a word from our sponsor.
This episode of My Good Friends is brought to you today by our good friends at Switch RCM. And Nate is here to tell us about physician underpayments. Tell us, Nate.
Physician billing underpayments are a real challenge for providers. Claim volumes are very high, payments are lower than payments when compared to hospital side payments. We created technology that can handle those large volume of claims, automatically identify underpayments to help our provider clients recover those. And we do that using standard 837, 835 claims and remittance and contracts. That's all we need to help providers unlock that underpayment revenue.
Folks, it's a huge issue. So much volume. We know that Switch is doing just amazing work here. Contact Nate directly at nate@switchrcm.com for more information. Thanks, Nate.
Thank you.
Now, back to the show.
Yeah.
This one
And
time I
like,
did this assessment that was like, I did this assessment and we were doing, we'd shadow staff, like, you guys, I'm sure you had this, Katie, where it's like someone was shadowing a staff member just to see what processes were. So I'm shadowing somebody and I just asked I was just shooting the shit with them, right? There was a few ladies in this one office. I can't remember what it was, like financial clearance or something. And I was like, oh, so like, how do you like working here? Like, I'm literally just asking random questions that don't have anything to do with what my actual assessment is. This is like, I'm just getting to know them. Like, how do you like working here? Like, what's the vibe like? Just getting. And it was like an innocent question. The next day, the rev cycle leader was so angry, and he's like, basically just was like, you were asking appropriate questions, and then shut down, like literally just shut us down. I was like, because I asked someone
How do
if they like working here, like, are you out of your, and I was trying to remind mind of my going back to like, what did I ask, like what could I have asked? It was like that one thing, but it was like he was just ready to just attack.
so
That was one of the
my
worst things. It was
my
terrible.
story about shadowing. So before I joined the health system, the reason why my boss who hired me, Ramona Fryer, who was our old VP of Rev Cycle at FMOL, she had worked with me with a previous company. She was at FMOL, and I was handling the cash posting for a partner in the oncology space. And Ramona had just come back to the health system, and we were having massive cash posting issues. That's how Ramona and I got to know each other. Anyway, she had just come back to the health system. I had no idea who she was. I get a phone call one day from the health system, called up my other company that I'm with and said, hey, we're sending over this lady who's going to sit down and wants to see y'all's cash posting process. And I was like, and they want to shadow your people. And I'm like, oh, another consultant. Here we go. Another consultant coming in. Okay. So I pull over my intern, and I mean, he is like 20-year-old intern, or well, I guess he was like 21, but he's like fresh MBA intern, whatever. And I pull him over and I'm like, grab the biggest stack of papers over there, go sit in that corner and show her the process. Like, he wasn't even involved in cash posting, but I was like, overcomplicated. I'm tired of them overbearing and sending us people. So, I don't know who Ramona is. So Ramona comes in, and I told him, I was like, I'm not even going to be here. Just, sit her in the corner. So he goes to get Ramona. He pulls her back. They're sitting in the corner office, and and he texts me and he's like, "Hey, she's here. I really don't think I'm supposed to be meeting with her." And I was like, "Yeah, work with her." And my CFO then, like 10 minutes later, he calls me and he's like, "Where are you?" I'm like, I don't know. I'm off site. I don't know. I got that Ramona lady something sitting with the intern." And he was like, "Get back over here now. She's the vice president of revenue cycle for FMOL, and you have her sitting with the intern. And what is he doing?" And I was like, "Oh, I had him preparing deposits." Like, I had Ramona, because I didn't know who she was, and I had that attitude. And that was like the first, like, wait, because then I got to meet her, and I'm like, okay, well, this woman's awesome, and she's trying to fix the process, and later on she hires me. But yeah, I mean, that was like my immaturity and slap in the face. And yeah, so to your point, like, I'm not doing that again, because that was a horrible decision.
It's
Yeah.
almost like the ego takes over a bit and be like, why do I have to do this? Like, I'm smart enough, I'm good enough, and you're just like, this is beneath me in a way. Like, I do think that, like, just the ego takes over. Like, you're not, I've done the
Yeah.
same thing where I was like, oh, I don't need to. It's like, okay, well, can't we just take a little time? Like, you learned, like, you didn't know who that person was, and turn out she
Yeah.
hired you later,
Yeah. Like, come to find out, she's this legend.
which you could have
Um,
totally ruined that. Your CFO hadn't called you, it would have totally been ruined.
well, yeah, I mean, luckily, like, and, she loves to tell that story about how I threw her with the intern or whatever. But,
Oh, I'm sure she does.
yeah, yeah.
I'm sure she
in
does.
her
So she was
in
using
her
that one.
retirement days. Yeah, but it yeah, I mean, it was definitely lesson
But we
learned
all
that
have
now.
stories like that. We all have
Yeah,
stories like that.
yeah, yeah. So we recovered though.
That's good. It's
Yeah.
good. All right, Tina, anything else? What else you got for him?
Oh, wow. I was just thinking because, and I will say this about Judi, because I think Judi does this beautifully, is like, I think the overwhelming message here is like going into any engagement with a human being with an open mind and being willing to listen, and then to Judy's point earlier, to be curious about them and like what's going on. I feel like that's like the big takeaway here is like, right, I think I have always been a person, not always, I've become a person who I'm always like interested, maybe there's something I don't know, or I mean, I know there's plenty I don't know. Let's start there. There's plenty I don't know. But I'm like, even if it's a younger person, like everybody has a different perspective. We've all walked the world a little differently. So what can I learn here? And can I be open to, the information that's coming at me? And I think, I mean, Judi often talks about how important it is to listen, right? She's like, sometimes I just sit and I listen. I listen to people talk about this and that and the other thing, and I pick up and I'm able to pull a thread together just from sitting and hearing what people have to say, and not necessarily being so felt to consult, right? Like you're not like, I'm going to stand here and give advice that no one's asking for. Like to be willing to take it all in, I think is incredibly valuable.
Yeah, and important point to add. One thing that I'm always stressing with my team. So like inherently we have a lot of conflict. Like I'm dealing with an HR issue today that I have to go deal with. I wanted a team member to start on 12/1. She's not going to be able to make it. So that's going to delay her benefits, activating for the new year, et cetera, et cetera. It's really easy for me to get frustrated that someone dropped the ball. Like, it's really easy for me to default to that. But one thing that I'm always stressing with my team, and then I have to remind myself is, but take a step back and think about their perspective. Like, no one inherently is doing their job bad. No one, like,
or
like,
deliberately to spite you. Like, right? Like, it's not personal.
No, and it's so easy to like jump back and be like, well, you know, so-and-so screwed this up or so-and-so forgot to process the paperwork. But the end of the day is they had other priorities. They had to deal with it. We were late in getting some of ours. Like, it is what it is. The situation is here. Let's adjust then. And I can't change the past. I can't change how you're going to react, but I can change how we react collectively in the future. And I'm like constantly pushing that to folks and to our team.
Judy's late for a meeting.
I know.
Yeah, I know. That was like so perfect. I'm like, oh my gosh, I thought I turned my volume off.
Well, it's probably FMOL calling. Hey,
Yeah,
Judi,
like,
we need you.
Here? Why aren't you here?
Yeah.
Yeah, I would also say from on a similar vein that Tina said of being a consultant, one of the things in an early stage when I was a young consultant was I would listen to someone and I'd be like, and they would just say they were complaining and just blow it up, right? And you're just like, God, this place is a mess, you know? Like you're immediately taking kind of one person's perspective and like making it like truth. And I think as a consultant, it's like you have to be very careful. Like I learned over time, like be very careful. Like, okay, that's their perspective, or that's their thing they're dealing with, or they're just having a bad day. Like you have to be able to like take all of the data points and not just make a rush assumption of like everything's a disaster or it's all falling apart. And I think it's easy to do that. Because if I caught you on a bad day, Katy, like it would be, who knows why you'd feel versus like today where I'm pretty positive about things. And it's like, it's sometimes just like perspective on like the day. And so you have to be very careful as a consultant, not like rush to judgment. And then, because my relationship was Bob. So I had two different stints at FMLHS actually. When I was in McKinsey, I did a whole thing in assessment. Right. And it was, and I'd be careful about going back to him with just being like, because this is the other thing consultants get. CFOs like day 2, like, hey, so what did you learn so far? It's like nothing. Just doing our assessment. Yeah. It's like you can't be pulled into the trap. Like, actually, you got like 10 things. Like, right. It's like you got to be careful. And I'm sure I made mistakes. Like, I'm sure I made mistakes where you felt you wanted to get that person's approval. To get, to like the early, right. Like, I'm doing a good job, look at all I found. It's like, no, just like do your thing and your process and don't sell someone out just because you think you know something. So that just reminded me of that when Tina was saying that.
I'm curious, and I don't know if time check, if we're good or whatever, but I am curious if you have a minute, what could like, advice for folks in my shoes, like when we do have consultants in, like from the group here, if anyone wants to weigh in, like how can we make the process better, easier, flow better, make sure that we achieve the desired outcome whenever we do have a consultant come in?
I think there's two parts. One is like the attitude of like the framing of that you would do and you would do with your staff. I think is super important to kind of set the groundwork of like, hey, they're coming in to do this thing. Doesn't mean they know everything. It doesn't mean, and it's not like an indictment. It's like, let's just figure out if we've got areas of opportunity, which we probably do. We know we do. And we know everyone does. There's no one's working perfect. I think laying the groundwork is super important because then it sets the stage for we're not, not everyone's on the defense. Like, even if you aren't, like, it could be like other people are because they're worried about, like, what Judy described earlier, like losing their job or, like, getting found out or all those things.
Or that Ben's going to roll in hot and tell them they can't have popcorn in the morning.
I did do that, but I wasn't a consultant to be fair. I did cut out popcorn before 6 a.m. You might as well have thought I'd
they like burnt popcorn.
Club the baby seal on the way into work. Yeah.
Yeah.
Popcorn gate.
So I definitely think, that's one aspect. I think the other aspect is what I saw a fair amount of was passive aggressive behavior, where it was like, I'm gonna get you that data. And they were like, I ain't getting you shit. It was like
or like what I did to Ramona and like the thump test. Like she wants to see
Yep.
paperwork.
Okay,
Like
fine. I'll
pull
make her,
every piece of paper in the
yeah.
office and put it in this cube. Yeah, that's not
I mean, I
smart.
remember asking someone to see like account reviews. Like, can we just walk through some accounts? You guys sit down, we'll just walk through accounts. Why would you want to do that? Or no, first it was like, oh, of course, I'll set you up. And then it was like, he clearly told that person, like, don't show them anything.
Oh,
And so I was like, oh, this is fucking useless. I mean, like, why are we doing? I literally stopped him. I was like, this is
Right.
useless. Okay, we can stop. Because I just knew that person was like setting him up. And so I think there's this passive aggressive, like, you may not even be doing it consciously. I think that's the other thing. As a leader, you have to check yourself. Am I like telling them lip service and I'm going to be nice to them, but ultimately, like, I'm just undermining them? And I may not even realize I'm doing that, or I'm kind of sending that vibe to my staff and they're picking up on it. There's a lot of unsent signals, I think. So I think for me, that's the advice I would give them. Just and be clear with your CFO or whoever your leader is and be like, the expectation is what? What are we doing this for? Even if I didn't choose to do it, tell me exactly how I can use them. What you did in the beginning, like, okay, I got them, I'm going to use them. But most people have a temporary thing. They don't have the longer term thing.
fair. Thank you. I'll take that in mind. Hopefully, we don't have an assessment anytime soon. But
Oh, you never know.
it's good. No,
Judy's
no,
like,
I was joking.
Can
right,
Judy
I was
just
joking.
surprise you with one?
Judy's
I was
penciling it
joking.
in.
I was joking. No, I mean,
Judy's
no,
like,
look.
let's do one tomorrow.
Well, actually, we have a strategic planning session in about 2 weeks. That, I'm
Yeah.
hoping that she actually can. Yeah, like tell me what I'm not seeing. Absolutely. And that's part of the benefit of having them embedded is that like they don't really have to do an assessment. They already have it. They already know. They know where our weaknesses are. They know where our strengths are. They know what other people are doing and we're not.
Right.
Yeah.
Right. Good stuff. All right. Well, thanks, Judy. Thanks, Katy, for doing this with us. It was fun. Glad we got our technical issues straightened out. We made it work.
Against all odds, we made it work, huh, guys?
Against all us. That's right.
Yeah.
All
Well,
right.
thanks, Ben.
Um,
Appreciate the time.
good
It
to
was
meet
great.
Thanks, everyone.
Thank you.
Yeah, good to meet both of you. I appreciate it so much. Y'all have a happy Thanksgiving.
My good friends, my good friends, my good friends. Do a little bit of everything. Cause it takes a bit of everything. My good friends, my good friends, my good